My 2-year-old boxer has just been diagnosed with severe spinal arthritis. Managing the pain, but how much exercise should she be having? She's still a crazy girl at heart with lots of energy.
Unfortunately, we see that a lot in young boxers, but I usually still want them to do regular exercise, but probably not that like stop and go, like chasing a ball where she would put on the brakes right away and hurt her back more. But I think keeping them exercising, swimming, rehab, that kind of stuff is really important for their mental and physical health long term.
Seeing the arthritis.
It's kind of a congenital abnormality in them, and spondylosis deformans, and we see it in young boxers, and you'll see the bridging spondylosis in their x-rays when they're really young.
My first question would be, how did you obtain the diagnosis, and was this confirmed in some way? Like, is this a presumptive diagnosis? Did somebody just see the dog being sore and then say, oh, it's probably that? Or did you actually perform x-rays? Were those interpreted by a specialist like a radiologist? And have you been referred to anybody for ongoing management? There are physiotherapy specialists.
Other therapies that I would include would be cold laser therapy and acupuncture. So for any back arthritis and back pain, they seem to do really, really well with alternative treatments too. I don't do any chiropractics, but it's getting more popular as well for that kind of stuff. So I'd probably be doing a bunch of things preventively and definitely trying to keep her moving still.
Okay, so I actually saw this patient on emergency for problems that stemmed from irresponsible actions on behalf of a breeder. Which unfortunately is becoming exceedingly more common.
Yeah.
Basically, this patient had really severe pneumonia to the point of being life-threatening. And even with supplemental oxygen, I remember that we were concerned that she would need to be ventilated. And it was just a little puppy.
Oh.
It turned out that her breeder had some infectious respiratory bugs in their kennel. And the breeder had been tinkering around with antibiotics.
Yeah, we're seeing that a lot. They're coming from puppiesrus.com or whatever. You just pick your breed and then they come with like, here's your dewormer bunch of medications. Here's doxycycline. Here's metronidazole. Here's some type of alpha, and just give them a package of things to give even if they're not sick.
And they're antibiotics.
Antibiotics, yeah. And dewormers and stuff, yeah.
And so because they're not being used appropriately, these puppies are getting antimicrobial resistant infections that we actually can't safely treat. Like, we don't have drugs to treat them. So that's kind of what happened. This puppy ended up with some kind of a multi-drug resistant infection.
Yeah.
Luckily, the owners were extremely amazing and committed. The puppy obviously was in critical care for a while.
Yeah.
Under the care of specialists. And then they worked with an internal medicine specialist to finally clear this infection, which is why my question was, how is this diagnosed? Because in the game of the worst case scenario, which I always play in emergency, when anytime something happens, I'm always like, what's the worst case scenario? Like, what could it be? What's the worst case? Because if you don't think about that, then it happens and you're not ready for it. So I'm like, what if this bacterial infection like never actually got cleared and somehow it like spread to the spine?
Yeah.
You see patients that end up having these weird spinal infections that don't get diagnosed.
I feel like it depends on how the dog's feeling at home to kind of help with that. I agree. X-rays would be a must.
Yeah, X-rays. And you do radiologist review on everything? Like, personally, I do on everything.
We do them case by case right now, but we're using it more just to anything.
It's just like, if I didn't know the patient, I probably wouldn't even think of that. But because I do know that some sketchy stuff has happened. Yeah. And unfortunately, here's the thing, right? I would be pretty mad if my puppy was coming with medical problems that could be prevented if people could be more responsible.
Yeah.
So what, you have spinal arthritis, maybe that's not the biggest deal, but what if you come with heart problems or cancer and stuff like that, and then they're dying at the age of 2 or 3 or 4 or 5, right? And I probably shouldn't be saying this, but sometimes between us, we're kind of like, should we tell them that their breeder killed their puppy? Or should we just keep that to ourselves? And then we don't say anything. And then I'm just like, well, bet you $20 they go and get another puppy from the same breeder. You know? And it's just like, if somebody bought a car and it exploded 3 months later because of a manufacturing defect that could have been prevented on the line, people would be mad at the manufacturer. But when it's breeders, I mean, maybe we just don't do a good enough job of making sure that they have all the tools to be educated breeders and like responsible.
Yeah, I think it's both. I think we're breeding for the wrong things still in a lot of these pets. I don't think there's like malintent with it, and then we get these
not malintent, as I said. Just not knowing, right?
Yeah, not thinking far enough ahead about what you're doing for the future of the breed and stuff too. So
What would you say would be an indication for stopping exercise? Like,
I would say if we're like slowing down, slow to get up and down afterwards, where if it seems like it's causing, but I think any kind of moderate exercise would be fine in this dog, just not being like crazy running fences and changing directions quickly. But I think otherwise would be fine to exercise.
jumping on and off furniture and stairs.
I would probably try to avoid it if it truly is a spinal arthritis.
Jumping in and out of cars.
I would try to train them to have a ramp or something and stairs in the house, probably.
Work with physiotherapy specialists. Do you ever see like neurologic deficits with that type of spondylosis?
I don't know that I've seen enough of that specific one to know that. I would guess that they would be more prone to it, just given the bridging spine there. But yeah, I would guess so.
Okay. Sweet.